Hello, everyone. This is Mr. Donati. Today, we are going to look at HIV and AIDS. HIV is a virus that attacks the immune system, which is our body's natural defense against illness. The virus destroys a type of white blood cells in the immune system called a helper T cell and makes copies of itself inside these cells. A virus is a pathogen that needs a host to reproduce. The virus contains genetic material that will cause the host cell to change. Over a period of time, the immune system is slowly destroyed and can no longer fight against infection. Studies show that HIV may have jumped from chimpanzees to humans as far back as the late 1800s. The chimpanzee version of the virus is called simian immunodeficiency virus. It was probably passed to humans when humans hunted these chimpanzees for meat and came in contact with their infected blood. To date, the earliest known case of HIV infection in human blood is from a sample taken in 1959 from a man who died in Belgian Congo. AIDS was recognized as a new disease in 1981. How long can you have HIV without knowing? HIV can have a long incubation period. You may not have any symptoms at all for up to 10 years. At that point, HIV begins to make it hard for your body to fight off infections. So you can get infections that normally wouldn't affect you. When your immune system reaches a certain point of weakness, that's when HIV becomes AIDS. In developing countries, HIV presents a problem due to the lack of information about how to protect themselves, or in some cases, a lack of power to protect themselves. In sub Saharan Africa, 75% of the young people infected with HIV are female. When HIV enters the blood, it invades certain cells of the immune system, including T cells, which help identify and destroy pathogens. The virus takes over the cells and causes them to produce new copies of themselves. The newly produced virus break out of the cells, destroying them. The new virus infects other cells and the process repeats itself. As the number of viruses increase and the number of T cells decrease, the immune system becomes less capable of preventing infection and cancer. The body becomes susceptible to common infection and to opportunistic infections, infections that occur in individuals who do not have a healthy immune system. These infections are difficult to treat. With a weakened immune system, an infected individual suffers one illness after another. In the infectious diseases lesson 1 lesson, we discussed the immune system. When a pathogen enters the body, it triggers the immune system. In this case, the infectious disease is HIV. Once HIV is in the body, it attaches to T cells. At this point, the immune system can no longer communicate with B cells. Antibodies, therefore, cannot be made. B cells cannot secrete the correct antibodies. The HIV destroys the helper T cells. HIV germ takes over. The HIV virus slowly takes over. The person develops AIDS, and eventually this will lead to death. Remember, a person does not die from AIDS, but from opportunistic infections. As HIV slowly destroys the immune system, the HIV infection progresses through 3 stages. The asymptomatic stage: soon after exposure to HIV, an infected person may experience flu-like symptoms, which will usually go away after a few weeks. Many months or years may follow, during which the person shows no outward signs of a disease. Because of the lack of symptoms, this period is called asymptomatic stage. During this stage, the virus destroys helper T cells. People in the asymptomatic stage can infect others even though they feel fine. The symptomatic stage: when HIV infected person starts experiencing symptoms, he or she has entered the symptomatic stage of infection. Symptoms may include weight loss, a persistent fever, diarrhea, fungal infections. Such symptoms may not appear until 7 to 10 years after infection with HIV. The last stage of the HIV infection is AIDS. The onset of AIDS is usually marked by a very low number of helper T cells in the blood. At this stage, HIV infected people are usually experiencing even more severe symptoms than the symptomatic stage. Because the body's ability to fight disease has been weakened by HIV, they are susceptible to infections that a healthy person's immune system could easily fight off. HIV can be transmitted from an infected person to another uninfected person only in certain ways through blood, semen, vaginal secretions, and breast milk. You can greatly reduce your chance of HIV infection by abstaining from sexual intercourse and avoiding the use of injected drugs. Remember, there is a cause and effect of things. One thing can lead to another. In particular, people who use intravenous drugs risk the chance of contracting HIV because of sharing needles. How HIV is not transmitted. HIV is not transmitted by casual contact. You cannot get HIV by going to classes or eating lunch with an infected person. You cannot get HIV by holding hands or hugging an infected person. Families who live with an infected person are not at risk of contracting HIV unless they engage in high risk behaviors. Small amounts of HIV occur in saliva, tears, and perspiration. However, the amounts are so small that the infection from contact with these fluids is usually unlikely. On a final note, at present, there is no cure for HIV or AIDS, but the good news is that you can choose behaviors that will help you avoid this very serious disease. You can protect yourself from HIV by practicing abstinence, avoiding drugs, and avoiding contact with others' bloods and body fluids. And with that, thank you for watching. I hope you enjoyed the show.